So first, can you please begin by explaining for us the reasons behind the decision to change the name of your building here?
The issue of what we were seeing in homelessness and the drug addiction and mental health crisis was becoming too great to stay in a model that worked great in 2019. 2010, it was a great model, but we just quickly realized that the crisis of 2024 and 2025 wasn't working with our old model. So seeing more people overdosing on the streets, seeing less people making the decision to make changes in their life left us in a place thinking we were one of the last areas of influence in a lot of people's lives that need to change. And we just had to go to the drawing board and think, how are we going to use that last level of influence to make sure that they choose to live a different life?
Now let's discuss LCM Downtown Connections. Tell us about what factors led to implementing the new intake system you have.
Yeah, as we had more and more people coming in and out, relying upon 1, 2, or 3, 4 people's memories of who we talked to last, what their needs were. That worked when we were a smaller organization with less people. But we couldn't keep up with actually tracking how to make progress happen in people's lives. And so we began to research case management and found a Christian case management that worked with vocational, mental health, spiritual goals, all of these different things, did HMIS friendly for the state. We went looking at that and realized that with its help, we were actually able to have a face to every person, have a name to every face, have a list of needs, set goals, set dates, and be able to track whether we were actually able to help people get connected with churches, agencies, whatever needs they may have. And after we found the case management, we knew that it was the one for us. It was reasonably priced. And the only regret I have is not having done it 5 years ago.
All right, so tell us about how long it took to create or adopt this system.
Yes, we closed down and thought we would be closed for 2 to 3 weeks. It ended up being about 4.5 weeks. The company that we used is Mission Tracker, so their case management system. They fast-tracked us and did 2 trainings per week instead of 1 training per week. So we went through all of those trainings within those 4 weeks. We were actually active in the system on the 5th week. So from the first day that we opened up, we were checking people in, getting them programmed in, setting goals, and starting to track their progress. Most people use 3 months to 6 months, but we really buckled down and made sure that we were getting the most out of the program right away so that we didn't just leave more of a mess on the streets for the people that need to get off the streets, when we also had the concern of seeing more people die before their lives changed.
And were there any costs associated to the new intake system?
Absolutely. The minimal cost for it is $6,000 per year, $500 per month, which is way more reasonable than most of the medical health records that we saw out there, as well as this is specifically designed to churches and nonprofits and referrals and homelessness. So it's really able to even buckle down into the areas of addiction, getting people into treatment, asking the right questions, setting the right goals. And so, yeah, it's $6,000 per year, but definitely worth every penny. And it's one of the actual cheaper options that are out there.